Hello, I am Dr. DeAndre. Today I will talk about 3 things I never do as a cancer surgeon to protect my health. As a cancer surgeon, I see firsthand how lifestyle choices affect long-term health outcomes. Many diseases, including cancer, do not develop suddenly. They are often the result of repeated exposure to harmful habits over time. Scientific evidence shows that approximately 30 to 50% of cancers are preventable through lifestyle and environmental changes. This means that daily decisions, what you eat, what you are exposed to, and how you manage your health can significantly influence your risk. It is important to understand that prevention is not about extreme measures. It is about avoiding certain high-risk behaviors and following simple, consistent health practices. In this video, I will explain 3 habits that I personally avoid based on medical evidence and clinical experience. These are not opinions. They are supported by decades of research and global health data. Understanding these habits can help you reduce your risk of serious disease and improve overall health. Cancer begins when cells in the body grow uncontrollably due to genetic mutations. These mutations can occur naturally, but they are often influenced by external factors such as smoking, poor diet, environmental toxins, and lack of physical activity. From a medical standpoint, prevention is one of the most effective strategies to reduce cancer burden. According to global health statistics, tobacco use alone accounts for about 22% of all cancer-related deaths worldwide. Similarly, obesity, unhealthy diet, and physical inactivity contribute significantly to cancer incidence. The body has natural defense systems designed to repair damaged DNA and eliminate abnormal cells. However, repeated exposure to harmful factors can overwhelm these systems. Over time, this increases the likelihood of permanent genetic damage, which can lead to cancer development. Preventive health focuses on reducing these exposures and supporting the body's natural protective mechanisms. This includes maintaining a healthy weight, eating a balanced diet, avoiding harmful substances, and undergoing regular medical screenings. It is also important to recognize that prevention is a long-term process. The benefits may not be immediately visible, but they significantly reduce risk over time. Many patients diagnosed with cancer have identifiable risk factors that could have been addressed earlier. By understanding and applying preventive strategies, individuals can take control of their health and reduce the likelihood of developing serious diseases. The first habit I completely avoid is smoking or using any form of tobacco. Tobacco is one of the most well-documented causes of cancer. It contains over 7,000 chemical substances, including at least 70 known carcinogens. These chemicals damage DNA and interfere with the body's ability to repair itself. Over time, this damage accumulates, increasing the risk of cancer. Smoking is strongly associated with cancers of the lungs, throat, mouth, pancreas, bladder, and kidneys. Research shows that smokers are 15 to 30 times more likely to develop lung cancer compared to non-smokers. Even exposure to secondhand smoke increases risk. This means that individuals who do not smoke but are regularly exposed to smoke are also at risk. From a physiological perspective, tobacco use causes chronic inflammation and oxidative stress. These processes create an environment that supports cancer development. In addition, smoking weakens the immune system, reducing the body's ability to detect and destroy abnormal cells. The positive aspect is that quitting smoking provides immediate and long-term health benefits. Within a few years of quitting, the risk of certain cancers decreases significantly. Avoiding tobacco is one of the most effective steps a person can take to protect their health. The second habit I avoid is neglecting diet and allowing unhealthy weight gain. Obesity is a major risk factor for cancer and is linked to at least 13 different types of cancer, including breast, colorectal, and liver cancer. Excess body fat is not just stored energy. It actively produces hormones and inflammatory substances that can promote cancer development. Chronic inflammation is a key factor in this process. It can damage cells and increase the likelihood of mutations. In addition, obesity is associated with insulin resistance, which leads to higher levels of insulin in the blood. Insulin is a growth-promoting hormone, and elevated levels may encourage the growth of abnormal cells. Diet also plays a critical role. High consumption of processed foods, sugary drinks, and unhealthy fats contributes to weight gain and metabolic imbalance. On the other hand, diets rich in fruits, vegetables, whole grains, and lean proteins support overall health and reduce cancer risk. Maintaining a healthy weight does not require extreme measures. Regular physical activity, portion control, and balanced nutrition are effective strategies. Even a modest weight loss of 5 to 10% can significantly improve health markers. From a medical perspective, managing diet and weight is essential for long-term disease prevention. The third habit I avoid is ignoring early symptoms and skipping recommended health screenings. Early detection plays a critical role in cancer treatment and survival. Many cancers develop silently in the early stages, without noticeable symptoms. Screening tests are designed to detect cancer before symptoms appear. For example, colonoscopies can detect colorectal cancer early, and mammograms can identify breast cancer at a stage when treatment is more effective. Statistics show that early-stage cancers have significantly higher survival rates. For instance, early detection of colorectal cancer has a survival rate of over 90%, compared to much lower rates in advanced stages. Common warning signs should not be ignored. These include unexplained weight loss, persistent fatigue, unusual lumps, and changes in bowel or bladder habits. While these symptoms do not always indicate cancer, they require medical evaluation. Delaying medical consultation can lead to late diagnosis, which often requires more aggressive treatment and has lower success rates. Regular checkups and screenings allow for early intervention and better outcomes. Protecting your health requires consistent and evidence-based habits. Avoid tobacco use completely, maintain a healthy weight, and follow a balanced diet rich in nutrients. Limit alcohol consumption, as it is linked to several types of cancer. Engage in regular physical activity, aiming for at least 30 minutes of moderate exercise most days of the week. Protect your skin from excessive sun exposure by using sunscreen and wearing protective clothing. Ultraviolet radiation is a known risk factor for skin cancer. Ensure adequate sleep and manage stress effectively. Chronic stress can affect immune function and overall health. Vaccinations can also play a role in cancer prevention. Certain viruses are associated with cancer development, and preventive measures can reduce risk. These practices are supported by global health organizations and are considered essential for long-term health. In summary, the 3 things I never do as a cancer surgeon are: I do not use tobacco, I do not ignore diet and weight management, and I do not neglect early symptoms or screenings. These habits are simple but powerful. They are based on strong scientific evidence and can significantly reduce the risk of cancer and other serious diseases. Health is influenced by daily choices. Small, consistent actions can lead to long-term benefits. Always consult your physician before making significant lifestyle changes, especially if you have existing medical conditions. If you found this information helpful, consider sharing it and subscribing for more evidence-based health content.